Hello, friends. Welcome to Parkinson's EmPower Talks, a journey of empowerment and understanding for living your best life with Parkinson's. Kick back, relax, and get comfortable. We're here to make your Parkinson's journey just a little bit easier. I'm your host, Daisy Reimer. I'm a nurse practitioner specialized in movement disorders and the Director of Medical Advising and Education for the Wisconsin Parkinson Association. The Wisconsin Parkinson Association's mission is to provide hope, community, support, and resources for people with Parkinson's and their loved ones. Welcome to Parkinson's EmPower Talks. Today we're talking about accessing service and resources for people with Parkinson's. And my special guest is LeAnn Lanthrop, and she is a licensed clinical social worker with Froedtert Hospital in Milwaukee. Welcome, LeAnn.
Thank you. Thanks for having me.
Absolutely. I'm so glad that you're here. So tell us first a little bit about you and like what your role is with Froedtert in Parkinson's, if you don't mind.
Sure. I am the social worker for the outpatient neurology department, one of them here, but I cover the movement disorders. And I've done that for about 5 years, I think. And before that, I worked about 29 years here at Froedtert as a social worker on the neurology inpatient floor. Okay. So I've had a lot of experience with Parkinson's, and when I worked inpatient, there were a lot of challenges to finding rehab facilities or nursing facilities to take Parkinson's patients because the medications are so touchy and, just everything about it is unique.
Yeah.
And so I worked with great doctors who are still here, most of them. And I learned a lot from them about it. And so I jumped at the chance to take the outpatient position so that I could work more, instead of just discharge planning, work more with resource referrals. And that's a lot of what I do. I don't necessarily make magic happen myself, but I know where to send people who can help them with what they need usually.
Right. There's a lot of kind of misconceptions a bit about social work and what their role is. Give me a kind of a basic idea, if you don't mind, of what that connection is. Like, how would a person with Parkinson's access, your resources?
Most of the time they go through the doctor in the clinic or the nurse practitioner, physician's assistant, whoever is the provider, and let them know what they're looking for. A lot of times our doctors pick that up when they're doing their, talking in their appointment. They pick up some things and then they ask the patients if they would like the social worker to call them. Otherwise, people will say they'll call in or they'll come to their appointment and say, "Can I talk to a social worker?" So that's how it goes. We take the referrals. I don't see every patient in clinic because I cover several different neurology clinics. But when the doctors send a referral, then I know who I'm supposed to call and where I'm supposed to call them, and they give me a general idea of what they're looking for, so I can review the chart and kind of figure out what resources to have at hand. And then when I call them, then we talk about, just things, what they have, what they don't have, what they think they need, where they need to go for things like that. So I usually tell people if it's not a medical thing, I can usually find a resource or I know a resource. So
yeah, I'm sure you're well versed in your field and have a lot of resources at your fingertips. So for example, like what about people who are newly diagnosed? What would be kind of the cadence of that, and what support do you lend to those people?
We just started a new program here. So the doctors are trying to remember to let me know when a patient is newly diagnosed with Parkinson's. And so they send me that referral, and within 7 to 10 days, I give them a call and just make sure the doctors usually give them a really nice folder with a lot of resources and things to read. I make sure they got the folder, that they've had a chance to look through it. If not, I remind them there's good resources in there. There's things about exercise, which is really important, their medications, when they come into the hospital, how to advocate for themselves, what kind of things to expect. There's just a whole wealth of information in there. And so I want to make sure everybody got it. If they don't, I can send it to them. And if they have any questions, we can go through the resources to, talk a little bit more in depth about them. And then I just try to find out a little bit more about what they already have in their lives, as far as, do they have a good support system? Are they connected with the Wisconsin Parkinson's Association or any other Parkinson's affiliated, associated things out there? I usually tell them to check out your website because there's so much good information on there. And then while I'm asking them those questions, I'm kind of doing an assessment, also seeing if they need to talk to somebody financially about, their finances and what they can afford and how to plan for the future. Or right now, if they're looking at maybe needing, some caregiver at home for just a little short time, a couple times a week. But down the road might need more. There's some agencies I can get them involved with that can look at the whole picture. And if they're able to hear that kind of stuff right away, then I can either make a referral and have agencies call them, or I can give them the information, the phone number, and they can call agencies. So I do an assessment, make sure they're up to par, see how they're doing since they got the diagnosis. If they think they might need some more counseling for some adjustment or something, we can talk about what options they have available depending on their insurance and things like that. So it's just, if they started taking some meds, I ask how that's going. And if they have questions more about the medications, then I can let our nurse know and she can give them a call to go over that.
That's super. It's so important when you get a new diagnosis. I mean, you leave that visit so overwhelmed just with the diagnosis and maybe the new treatment that all sounds big names and a lot of times a day. So it's so overwhelming. So it's great that you're following up, because they might not have even perused that whole packet of information. It just might feel overwhelming, to go through and read. So just reminding them that it's there and that it is important to just learn a little bit more about it. So I love to do that follow-up. What about, so, a person just got a diagnosis and they don't know even how to approach like their family, maybe their spouse, the rest of their family, their children, or work. How do you explain the diagnosis to family and work, and what kind of tips do you give them on that?
A lot of times what I'll do is I will ask them if they want the nurse or doctor to call to give them some more tips. I also refer them to the association, the Parkinson's Association, because they might be able to help, or even look on the website there to see what information they have that they can either print off and give them or show them or go over that. I try not to get too medical. Our doctors do really well going over all of that in their appointment. And usually when it's a new diagnosis, there are family members with them. But I think one of the biggest, a couple of the biggest things to remember when they get the new diagnosis is, if they're prescribed medications, timing is important. Keep moving. Exercise is important, and it doesn't have to be really super fabulous weightlifting and stuff like that. Just basic exercise and keep moving. And I let them know if they feel that they need some particular counseling or something, we can find somebody to do that. And then if they're worried about talking to work about it, I have a lot more experience with that than necessarily going over the medical process of Parkinson's with people. But there's a lot of things involved with whether you tell work or not. The ADA doesn't necessarily protect or cover you, the Americans with Disabilities Act, unless your boss, manager, supervisor knows that you might need some accommodations. Sometimes people don't need any yet. They're not sure if they're going to or what kind of accommodations they're going to need. I always keep my phone available and for people to call me back. They usually end up asking the doctor questions and then they refer them back to me again too. One of the other resources I give people when it comes to work, what to disclose, what not to disclose, what is a reasonable accommodation, is it's JAN, like January, but JAN, and it's the Job Accommodation Network. They have a great website. They have a phone number that they try to work as a moderator between a job and a person. If the person tells them, what things they're having trouble with and what their job description entails, how accommodations and what accommodations can be made that aren't going to cost a whole ton of money for the employer, because if they are, then the law says that they don't necessarily have to make those accommodations if they're going to be too expensive for the employer either.
Right.
So I have some ADA attorneys that will talk to people that I've gathered over the years too.
Good. That's great that you have got some resources for them. And you mentioned about referring them back to us too. And actually this year we've got a lot of newly diagnosed workshops that we're going to be holding, throughout the state too. So we definitely have some additional information that we can give them as well.
That is so cool.
Yeah. What about your role as their journey continues? So now maybe they've had the diagnosis for a bit longer. What's your role as they go along?
I'm always available, again, because I'm not in the clinic all the time. I don't always know when people need more assistance or have a different issue. Again, the doctors are really good at keeping me posted about that, or the nurse will do that. I give everybody I talk to my name and my phone number, and I really encourage them to call me. And some hang on and stay with me and call me as time goes on. And others forget because life gets in the way and there's so much, like you said, overwhelmed and, just dealing with life being a bit different sometimes and how to explain it to people, how to keep working, all that kind of stuff. So a lot of people really, a lot of times will call our doctors and just say, I'm having this problem, or how do I get on Social Security, or is it time for that yet, or whatever. And then the doctors will make a referral to me so I can call them again.
Do you have any other additional resources that you give people besides the JAN that you had mentioned before for people who are working? Are there any other recommendations that you give them?
That's probably the biggest one. It just kind of depends on what their issues might be. I usually tell people, if they're starting to have trouble at work, or if some people are saying some things, and making trouble for them or starting to bully or whatever, they should keep a little notebook with them. Keep notes of who's saying what. You have to put the date and the time down. It can't be what you think they told you. It has to be what they actually said. And I can talk to them about, kind of if it ever gets to a point of going to court or something, what the courts expect, and keeping a calendar and a journal. And, then I can refer them again to attorneys or the EEOC or something like that. So it just depends on what the troubles are. We do have some, I think they're called work hardening through occupational therapy at a couple of the Freighter sites, where if they are having some trouble with some of the parts of their jobs, they can the doctor can refer them to these work hardening assessments, so they can do assessments to see, what would be helpful for somebody, or what might be beyond their scope at this point in time, or how to do something differently. So we do have that available at Freighter as well.
Yeah, and I mean, a lot of people want to still stay in their jobs. They don't
Yeah.
necessarily want to give them up. They're looking at retirement. Maybe they've changed that timing, maybe not, but they still want to keep with their jobs. And then some people, it's a matter of whether or not they qualify for disability and some of those processes. Are you involved in the disability processes at all with those patients, or is
Oh,
that?
yeah.
Yeah, okay.
Yeah, we try to figure out, if their work has short-term or long-term disability, and to talk to their HR about timeframes, and like here at Freighter, you have to be on PTO for 7 days before your disability kicks in, and then there's short-term and then there's long-term, and they each last so long, and everybody's got a little something different with
Right.
depending on their employer. And I look at their age, and I talk to them about what Social Security looks at when they're looking at their records, because they base their disabilities off of medical records. And they're looking at compliance, and they're looking at making it to your appointments and taking your meds and following up with whatever the doctor is recommending. But they also look at their age. And sometimes I find people that are 62, 63 that do qualify for early retirement. And so then you have to weigh out, because Social Security is right now taking 12 months or a little bit longer to make determinations. If you're going to be 60, 62 before that happens, then you can get that faster than a couple months than if you're waiting for disability. You don't get your Medicare until you're 65, but we have financial counselors here that can help people see what different insurance programs they qualify for, and what covers their meds and their doctors, and what they can afford. So there's all kinds of different options, but our financial counselors are the specialists in that area, but I can refer them to them if they need, worry about that, which
Right.
everybody does then.
Right.
So, and then, yeah, I tell people about, there's disability specialists through the Aging and Disability Resource Center in every county who can help them with the applications. I always tell people they know all the answers on the applications because they're about them,
Right.
but they look so awful when you get them.
They
There's
do. They're
so many
scary.
papers.
Yeah.
Yeah, so it's like, take a deep breath. Don't have any wine with you while you're filling them out so you can get through it, but take deep breaths and just go a question at a time, because they're all things they know. And they have to make sure that when they're claiming the disability, because a lot of people have different medical things going on as well. They
Right.
have to put the medical thing that's keeping them from working. And if that's Parkinson's, you list that first.
Right.
So yeah, and then they'll ask for doctor's notes and stuff. And so you just got to make sure you got a good paper trail and you're doing what you're supposed to.
Right.
So it's sometimes it's a toss up if you're going to be 62 soon, or if you want to go for disability. There's also an app through Social Security. If you go through the ssa.gov website that has my Social Security account,
Right.
and everybody has access to that. They can set up their account, and then they can see if they retire at 62 or if they are deemed disabled, how much money every month you specifically are going to get. And I think that is so helpful,
It really is. Yeah.
because people think they're going to get so much less than they really are, especially if you have a good work history. That's so helpful to be able to kind of plan your budget, and how much money you need to make and all that kind of stuff. And I think most people are really surprised
Yeah.
in a
Yeah.
good way.
Yeah. No, that's great advice. What about people? It's a different subset when a person's young onset. They've got a whole lot of different situations that come up. You're still raising a family. You might have to work longer yet, so financially, and just even socially and fitting in, telling people about it and things like that. What's different when you're addressing people who are young onset versus more age typical Parkinson?
Mhm. Well, and you kind of just named it all.
Oh,
That's
sorry.
that's what that's what's different, is that they're still working. I've had people who were, if they're their spouse may stay home and take care of the kids and they're still working and the spouse hasn't worked since the kids were born. And, you know, it just upsets the whole apple cart. And again, I think that's important for them to get on that Social Security website to see if you really feel you're disabled. You have to look at that and kind of see what your income might be so you can plan. The other thing is, does the are the things that they're experiencing now from their Parkinson's prevent them from doing their essential parts of their job? I mean, people, you get so anxious about stuff like this.
Right.
And sometimes the anxiety takes over more than the Parkinson's symptoms. And so we'll work with somebody on getting into some counseling or working with somebody on that. Support groups are important. Again, your website at Parkinson's Association has lots of that information. And as they always say, knowledge is power. So I think the more people can read about it, the more they can get involved even in the Parkinson's realm of things, the more you're ready to deal with outside of that.
Right.
And so I think it doesn't work very well if you stick your head in the sand. You got to come out, you got to read, you got to experience things, you got to talk to some people who've been there. So I support groups are always so amazing. And, you know, just prepare yourself for, you know, what might come or what, I mean, the anxiety a lot comes from, you don't know.
Mhm.
We want to know. And when you don't know, that really creates a lot of anxiety. So sometimes the doctors can help with that a little bit too, just in the acute phase until everything kind of settles in and you start learning things. But it is one of those things where you have to kind of weigh out, am I really disabled at this point? Maybe I just need some short-term disability from work until I get on the meds and I see how they're really going to work and I'm not having side effects. It's okay to do that. You know, a lot of it is just giving people also permission to, you know, you don't have to be on your deathbed to say you need some disability. You have to take care of yourself. And so it's just trying to balance everything and get to know as much as you can so that you can stay in the here and now and not worry about what next until it comes.
Right.
But yet you're prepared for it when it
Right.
gets there because you know where to go to find resources.
I think it's so important to have those resources at your fingertips and early before it becomes a crisis.
Mm-hmm. Yeah, that's what I tell people is when you look at the information in that folder, it's not that when you have a crisis, that's not the time to start leafing through there.
Right. Yeah, definitely.
When you're looking at the Parkinson's Association website, when you're in crisis is not the time to do that. You do that ahead of time so you know where you found things and you can get back there and read up on it. And a lot of times they'll direct you to your physician, social worker, an attorney, whatever you need, but at least you know where to find them because you saw it before.
And that's why I think that social workers are so valuable. That it's almost like you want to keep that card on your refrigerator because if something comes up, whether it's financial, whether it's more care needed or anything, at least you have that phone number. You have somebody that has the access to those resources and you don't have to try to drudge up who that person is. You already have made that connection, you know, now you access it. So it's so important to have that nearby, you know, so that if should something come up, you know exactly who to call.
That's what I tell people.
Yeah. And, you know, and it's different, you know, so you mentioned, we've been talking a lot about the person with Parkinson's, but there's also caregivers, whether it's a spouse or whether you're, you know, the adult children of a person with Parkinson's and things are changing over time and you're trying to plan. What kind of support do you see and lend to caregivers or care partners?
Mm-hmm. And I get a lot of that, and it could be brothers and sisters. I've had landlords be a caregiver before. It's all kinds of people.
Yeah.
Thank God there's those all kinds of people around.
Yeah.
Yeah, but I usually what I usually try to do is refer them to a caregiver support group.
Mm-hmm.
There are some online, there are some in person. I find a lot of people are hesitant to go to a support group because they think of something like AA right away. And it's not like Alcoholics Anonymous, but I've heard some people say it wasn't for them, and some people say they got so much good information. And so if it's not for a person, if they tried it and it's just not for them, again, um, knowledge is power, learning all that you can. I think it's important, even getting on the website, to know that you're not the only one. If the Parkinson's Association has something on their website, it's not because one person
Right.
needed to know that or had an issue with that. The other thing I always tell people too, who are caregivers, is, if the person who has Parkinson's maybe can't benefit from um, therapy, from counseling, because sometimes, if they have Parkinson's dementia or other things going on, and it's just their anxiety is too high and they need to maybe have some meds to help bring it down. But in the meantime, the caregiver is getting driven nuts. It's all right for the caregiver to go get some counseling. It's
Yeah, you really
perfectly
share
fine to do
those
that.
feelings in a household. I mean, however one person's feeling, it becomes shared experience for the other person as well. So it's hard to just disseminate and pretend like it's not there. Yeah.
Right. And then resentment and um, burden and all that can play off of those, and it gets to just not be a good
Healthy
a
really.
good time. Yeah, there's no healthy thing involved in that. So I always let the caregiver know it's okay for you. Plus, that if they go get counseling from somebody, they're seeing somebody not involved in the family,
Right.
not, too close in the relationship,
Right.
not judgmental. It's somebody who can help them get through what they need to get through. And sometimes the outcomes are what they wanted it to be, and sometimes they're not. But either which way, they have to get through it and be comfortable with the outcomes. So I refer a lot of people and help them figure out with their insurance who they can go see as well, because I think it's very important for caregivers to be able to do that.
Oh yeah.
And if they don't, if again, some people just don't want to think about going to counseling, and I get that, then let's explore the things that calm you down, the things that you need. Maybe you need somebody to come over and stay with the person with Parkinson's for 2 hours every week so that you can go to the zoo or to the park or go see a movie or have lunch with, whomever. So let's try those things at first if somebody's not ready for the counseling.
Yeah. There's a lot of guilt with that. I think that people don't, care partners don't want to take that time for themselves. Because it's hard, maybe locating somebody to be there with them. But
Mhm.
oftentimes there's a family member or a friend or somebody who's volunteered, but they've never taken them up on it. You know, they,
Right,
if people are volunteering, I always say, well, they wouldn't volunteer if they didn't mean it because they just wouldn't say anything. You just wouldn't get
right.
anybody, piping up at all. So if they're saying they want to help, they're letting you know they just really don't know how they can help, and you just have to direct them.
Exactly, exactly. So if you can ask them to do that, for an hour or two or whatever, even I tell people, even if you want, just go, you know, to the family room or your bedroom and read a book for an hour or two uninterrupted and not having to worry. Have somebody come over and do some activities or something with
Right,
the or even watch the movie with the person with the
right.
Parkinson's. But if you want to go off to another part of the house to be alone, certainly do that. Find your thing
Mhm.
that that lets you breathe
Right.
and have somebody do that. And like you said, people offer to help and they don't know what to do. If it's an hour or two, a couple times a week, people aren't going to mind that. The big things that we're always so afraid of leaving somebody alone for most likely aren't going to happen when that person is there.
Right.
Or if you need help with meals or,
Mhm.
ask somebody to bring you a casserole once a week or something.
Right.
People will do that and they want to help.
Mhm. When people call us at WPA, especially caregivers, and they're looking for more help, I always ask first, what are you looking for? Advice on like health care to help take care of that person, Or do you prefer to do that? And it's the other stuff like the shopping, the housekeeping, things like that, because there is a delineation there and you know, obviously look at different people that would come in and help. So it might be giving up that you're not getting the house cleaned exactly the way that you like to have it cleaned, but at least you're there if you feel like you know your loved one the best and want to be the one to give that hands-on care. Or if you feel like, you know what, I'm not equipped for that. I don't know if I don't know if I can physically do it, but I also don't really maybe know how to go about doing it. I want somebody else to take care of that piece, and I can manage the shopping and the cleaning and the cooking and things like that. So it's super important just to figure out, even if it's a family member saying that they can help out, where can they help out? Maybe it's just shoveling the driveway or, you know, something like that. It seems like it's a big burden because you've got to be able to get it done. But they want to help, they just don't know how.
Yeah, and it is hard when you're so overwhelmed. It's really hard to pinpoint or narrow down or not look at 24 hours a day, every day of the week. Right. So yeah, asking people exactly, you know, I have people say, well, I need help with everything. Well,
Sure.
yeah, you probably don't, but
Right.
let's go through some things. What are you having the most difficulty with? Is it the shower? Is it the, you know, the cleaning? Is it the cooking? Is it, you know, what is exactly it? And is it something that has to be done every day? Or does it take hours to do it? Or, you know what? And then if you're calling some of the resources that I give people, they know more what to ask for than just saying, well, I need help with everything. And then they say, you know, oh, I guess I probably can't afford that. And then they just drop it. No, you could probably afford somebody maybe to come in once a week or every 2 weeks to clean. Right. Or somebody to snow shovel, especially this winter, isn't going to make you go broke because we've hardly had snow. But, you know, if you need help with that, or running to the store, or whatever, I mean, you can get things delivered now too, which probably is the one thing COVID did for us that was really super fabulous, was everything is fairly accessible, maybe with a cost, but it's accessible. You can get your medications delivered, you can get your groceries delivered, you can get just about anything delivered. So some people don't know that. Mm-hmm. And so I can let them know what's available out there for that as well. Right. But some people love to go shopping. Right. And
that's their social, that's their way of getting out and seeing people. Yeah.
Yep. Mm-hmm. Yep. So it's just kind of helping people hone down exactly what everything means to them, and let's pick out a few things and maybe try one or two to begin with. And if that turns out to be very helpful, you know, maybe we can check out some more if they need to.
So for example, if that scenario we were talking about, somebody calls in and they are a caregiver and they need more help either in their home or with care, where do you normally kind of start guiding them? Like where do you steer them?
One of my big referrals to people is the Aging and Disability Resource Center in their county. I call them the warehouse of resources.
They really are.
Because, yeah, I mean, I don't even know what all they have access to or do for people. And it's different all the time because things are closing, things are developing, whatever. Right. So I usually refer them there. Sometimes some of their programs take a while to get into. But sometimes they can give you some assistance right off the bat. So like they have transportation for people 60 and older, that's very reduced rate. And it's not like hopping in your car and going somewhere. You have to do some planning, but it's there. And even support groups, or they do have every ADRC has a dementia specialist. So if that's part of the problem, they're so helpful with all kinds of stuff. And if people are looking for, potentially, I get a lot of this is maybe a caregiver, maybe assisted living, maybe, you know, I'm not quite sure what we need. Right. Then there's some senior advisor agencies that are free to people that will come to their home and do an assessment and link them up with some elder law people, some financial planners, some caregiving agencies. You know, they'll help them hone that down too, to figure out exactly what might be the best option for the person right now. Is it staying at home with a caregiver, or are their needs so much that maybe being in a facility in assisted living or memory care, depending on, what all things they need help with and what they're looking for. And then they can find things that are usually within people's financial abilities, and they take you on the whole journey. And again, their services are free. The services they help you set up aren't, but they will help you kind of wean it down so that it's not so overwhelming and you don't have to spend a fortune for somebody to sit there at your house when maybe they don't need to sit there for 8 hours a day. Maybe they need to be there for some, big stuff like
Right.
showering, bathing,
Right.
whatever, right off the bat in the
Right.
morning, and only a couple mornings a week. So they help people with that a lot too. And then they can follow them throughout their whole journey if they have caregivers, and then maybe they get to a point where they're needing more help. They can help because they already know, the people, and the people already know them. They can help them find what the next level
Or
is, and
transitional care.
yep,
Yeah. Mhm.
and where the openings are, and how to finagle some admissions and some financial stuff. And I mean, they're really good at that.
There are a
So,
lot of things that we just don't know about, and you don't go into aging knowing about those things either. And like you said, sometimes, the focus is just on the needs and how much care is needed. But then there's the financial aspect of what can you actually afford, and they're taking all of that into consideration and guiding you along. And then, of course, if there's anybody that's moving or anything, you want to make sure that it's not, you're going to have to, not going to have to move a bunch of times, right? That there is that transitional care too. So I think it's so important to have that advocate. So I love that you are connecting them with that, because it makes the whole task so much less of a burden to the caregiver. And then that's just a smoother transition for the person.
oh yeah,
Who,
because most people have never done that before.
no.
So where do you even
Oh,
start? I mean,
right.
I can hand people a book with all the information, all the assisted livings and memory
Right.
cares, but
But
where do
it's
you start?
overwhelming. Right.
Yep.
Yeah.
I mean, I've been doing this for
Right.
34 years, and when my dad needed stuff, I was like, I have no idea where to start. And so I had one of those agencies come over and help us figure out what, and besides, he wouldn't listen to me, but he would listen to them. So
That's a good point
sometimes
though,
that,
right? Yeah.
yep, sometimes you need that. I've been hearing that from a couple of patients today. So it's nice to have people who have their finger on the pulse of all of that stuff
Right.
and can tell you what's available, what you'll need, and just go from there and help. They'll set up interviews with home care agencies. They'll set up tours of facilities. They'll go with you so that they make sure all your questions get asked.
Mhm.
They're just so helpful with that, and knowing that you don't have to pay for all of that.
And they're also going to have more of an idea of how much expertise they really have in Parkinson's or dementia care too, right?
Exactly.
The hardest thing for a caregiver to do is to relinquish care to somebody else. They better know Parkinson's as well as they do, or, because you want that loved one taken care of. But yeah, that's great. Any other resources that you have if a person is struggling with dementia that you tend to share with people or caregivers?
I think the dementia specialists at the ADRC is usually my real go-to, because they will kind of do what the senior advisors do. They will come to your home, they will do an assessment, they will look at everything, they'll help you figure stuff out.
Mhm.
And a lot of times what I find out is that family members of the caregiver of the person with dementia don't always have a great understanding of really what is dementia. And so the dementia specialist can explain that and explain how, they're not doing that on purpose. Their brain just isn't capable of doing that anymore. And I think it's really hard when you're a loved one of a person who is getting dementia, and they're just not doing things they've always done before. And
Yeah.
it's hard to understand why they can't, because it just seems so natural, and just like, just breathing.
Right.
I don't understand why you can't do this anymore. You've always done it. So I think getting, again, their knowledge is power. So the more you know about it and the more you know, instead of getting frustrated with that person, how you can just take a deep breath and help them and understand that they just can't do whatever it is anymore. Mm-hmm. So I think they're probably my go-to number one resource for people with dementia. There are specialty programs here at Freighter that work with patients with dementia and memory problems. I will refer people to the Alzheimer's Association, but a lot of what they do now tends to be more research and information as well, but they don't do as much of the resource referrals as they used to. So,
Yeah,
plus we have
a lot of the
go ahead.
ADRCs, I know even Sheboygan County does a big dementia care conference and things every year, and just they do really have a lot of resources through the ADRC. Yeah.
They do, and they're the specialist.
Mhm.
And so if there's other things that they can refer people to, they probably know those resources better than I do. So I want them to get to the right people who can give them the right information than me bumbling around trying to figure it out too.
So for those people who might not have like a card or a connection to a social worker, what would be their first step if they need more help or more support? Would you say ADRC is the first place to kind of go and reach out to, or is there another step or another place that they should look?
I think that, or if they contact their doctor and ask them if they have a social worker that they can refer to, that's another good start as well. So I think either one's a good thing. I think most outpatient clinics these days seem to have social workers assigned to them. But I think the ADRC is also a good one. People just need to know that you don't always get what you want right away or what you need right away, because they're like everybody else too, where they're a little behind the eight ball with staffing and stuff like that, at least in Milwaukee County. And other smaller counties, I think, can do quicker, faster. But because they are the resource warehouse, I think they're a good starting point as well.
When you mentioned like WPA, obviously, as part of your toolbox, do you have anything else that you utilize in your toolbox whenever you're referring people?
Parkinson's Foundation. And I want to say that you two are probably the WPA and the Parkinson's Foundation are the biggest ones I refer to if people are looking for information and resource kind of stuff. There are other ones, like I think Michael J. Fox really works on research and donations and things. So, if somebody's interested in that part, but you guys and the foundation also take donations to work on stuff. Thank you guys. The WPA is well-rounded in all of the information that you provide. So I do, and your webpage is really easy to get around. I'm not the webbiest person ever either. So I figure if I can get around it, just about anybody
can, huh?
Yeah. And I'll give out the phone number if people don't really use a computer, have access to it. I'll give out the phone number because it's good to know when the symposiums are coming up and things like that. And
I always close out with, if you had to give our viewers one piece of empowering advice, what would it be?
One piece is hard. I would say, don't wait for a crisis to find your resources and your information.
I like that.
I think that's the biggest one. And the other one is just know your resource, know where to find your resources, but don't wait for a crisis to happen. Peruse things and read things before it gets to that point.
I always say that, the best laid plans, if you've got that on hand, it hopefully you won't have to utilize it or need it. But darn well something's going to come up if you don't have it planned out and thought out well. So a little bit
exactly.
Right.
And if you have the information and you know where to go, then it probably won't be a crisis for you.
Right. That's empowering. And that's exactly what we're trying to do here, is say, this is where you need to go so that you have your ducks in a row and the resources that you need. And then hopefully you won't have to utilize them, but if you do, you know where to go.
Exactly.
Thank you so much for joining me today. I've really enjoyed our conversation. You've been a wealth of resource for everybody.
Well, thank you. I've enjoyed doing this.
You have a great day now.
You too.
Take care.
You too. Bye.
The Wisconsin Parkinson Association is a grassroots organization funded by people like you. To support more local programming like this, visit wiparkinson.org.